There's been a lot of media attention recently about prostate cancer. A question I'm often asked is, if prostate cancer is so common, why isn't there a national screening program using the PSA blood test? The answer is that PSA testing isn't perfect. PSA levels can be raised for reasons other than cancer, such as an enlarged prostate, inflammation, or even recent exercise. Equally, some men with prostate cancer can have a normal PSA result. Because of these limitations, a national screening program hasn't been introduced in the UK. However, that doesn't mean PSA testing isn't useful. In fact, PSA testing can be a valuable tool when used in the right way. It can help identify men who may need further investigation, and in some cases detect prostate cancer at an earlier and more treatable stage. This is particularly relevant for men over 50, men with a family history of prostate cancer, and black men who have a higher risk of developing the disease. The key is that PSA testing should be part of an informed discussion. Here in the clinic, we look at your age, family history, symptoms, overall health, and individual risk factors before deciding whether testing is appropriate. We believe in helping you make informed choices. If you're concerned about your prostate health or wondering whether a PSA test is right for you, we'd be happy to discuss it further.